All right. Hi, Joshua. How are you?
Hey, how's it going?
Good. Thank you so much for coming on. For those of you who do not know this lovely human, his name is Joshua Garcia. He is an attending emergency physician, and I brought him on today just to talk about, what's been going on with COVID, what it's going to look like when festivals open up, and how so many of our ravers' tolerances have dropped, and how to approach whether you're utilizing substances or alcohol or just in the sun for way too long, how to do things safely so that when we are back to normal, everybody is good to go and not putting their body in consistent danger. But thank you for coming on. Tell us a little bit about yourself real quick.
Oh, yeah. So like you said, I'm an emergency medicine physician. So I went to medical school at the University of Florida. I did undergrad there too, and then I went to the Indiana University Health for residency, which I finished last year. So now I'm a regular old doctor, done with training and that sort of thing. Um, and yeah, so in the emergency department, we basically kind of see all the problems with healthcare.
Yeah,
So
which is a shit ton of problems right now.
which is more problems than we could probably talk about in like 24 hours.
Yeah, I can't even
uh,
imagine.
but I'm not an epidemiologist or anything like that. But I mean, I've seen hundreds, probably 1,000 patients with COVID by now, as have most of my partners and colleagues. And so I think it's pretty easy for us to kind of get a sense of how things have gone and how things are going and where they're going to kind of end up.
Yeah, I mean, what do you see? Have you seen, I want to say, like drastic changes in the last like 2 to 4 months, whether it's been an influx or a reduction? Because I know the mortality rate per se, granted, I could be looking at totally fake, publicized, media driven statistics. But from my understanding, the mortality rate has gone down, but the number of cases has gone up because people like yourself and myself are out about living their lives and you know, they've got COVID and then they're giving over it like normal.
Yeah, that like the whole thing is like super complicated because really what we've seen is kind of and the way people have kind of got to see medicine evolve in real time. So like if you look at how we treated diseases like 40 years ago, like common stuff like say like strokes and heart failure and heart attacks and those sorts of things. And if you look at what we do today versus what we did then, you'd be like, what the fuck were you thinking?
Yeah, I can't
You know
even
what I mean?
imagine.
And COVID is such an interesting virus because in some regards it's totally just like a cold, like the mortality rate's not super duper high and that sort of thing. But in other regards, it does stuff that we've never seen before. And so when we started treating it, we were kind of treating it as best we could think of.
Yeah.
We had no information on really what it did. So we were doing stuff that was actually kind of harmful to patients.
Mhm.
And then, and I can explain that more in a second. And then, like, as it went by and we got just more understanding about what the disease was and what worked and what didn't work, the mortality rate is kind of just de facto going to drop, just kind of like how for heart failure, the mortality rate has gotten a lot better for strokes, for heart attacks, and those sorts of things. Um, the unusual thing about it is, in addition to just the respiratory stuff, like it has a big like preponderance for causing blood clots, which we've never seen before.
Mhm.
Like I've seen a 20-year-old with just massive blood clots in his lungs that almost died, as
So
have
crazy.
most of my colleagues. It increases your risk of stuff like stroke. All these patients have to be on really high dose blood thinners. So I've actually myself have seen a couple patients die from bleeding complications from being on blood thinners, which you don't see with like influenza and that sort of thing.
No.
Like there's a kind of marker like of your oxygen levels. Like when we started this in February and March, we were seeing people with oxygen levels of like 50%, which like prior to taking care of like prior to COVID, we've never seen that unless you were dead. You'd
Mhm.
never had levels that low unless you were getting CPR essentially. And so we were seeing these patients and they'd come to us and they'd be talking and we'd see their oxygen numbers were like not compatible with being alive. And so we put them on ventilators. Like we didn't know
See,
what else to
so
do.
to the ventilator very quickly. So is what I'm hearing is that, the first kind of line to response of the oxygen levels dropping to 50% was to go to the ventilators. And now it's not exactly the play that should be happening.
Right. And that was the exact wrong move. and
Oh, yeah.
it's like But you could see, like, based on what we know, like, so we had no information on this disease, right? And we see
Absolutely.
patients that have these dangerously low oxygen levels, and we're like, well, what the fuck do we do? You know, like, they're going to die. Because before that, our experience as, you know, emergency doctors and other doctors is when someone's oxygen level is at critically low, their heart's going to stop beating.
Hmm.
And that's just how it is until
Yeah.
COVID came along. But these people can survive with, like, I mean, we had a patient the other day who had an oxygen level of 25%. And it's like, how is that possible? And
How are
there's,
they still breathing? Like, how are they, yeah, like, how are they still alive if they reach that level? So these are just things you guys have never seen in the last
yeah,
decade, X amount of years.
yeah. And that's the thing. We've just never seen it, and we still can't explain it. And so before we were putting them on ventilators to fix their oxygen, and now we do stuff like putting them on high flow oxygen, where we give them like 40, 50 liters of oxygen a minute, which is a ton. Like, it's actually so much that when LA County and California was having their big surge, they were running out of oxygen in the hospital. Like, can you imagine a hospital running out of oxygen?
I can't even imagine. And it's so hard for me to conceptualize too when it comes to the point of locking down, which I guess our country didn't really fully do to begin with. It's so hard to see a county such as LA that is so cutting it tight, closed down, know this, know that. They just opened outdoor dining again. And yet their hospitals are totally full, running out of oxygen.
Yeah.
It's very hard for me to conceptualize.
Yeah, the whole, you know, we went about this like entirely wrong, and not like to make this a political thing or anything like that, but like the thing about lockdown is it had a really good opportunity to work if when we got out of lockdown people did the right thing. You
Yeah.
know, like, there have been a number of studies, because you'd think that transmission in the hospital would be really high, right? Because when this all started, you know, all the protective equipment and masks and gowns and all that sort of stuff was in super short supply. And you'd think that you'd have a ton of transmission from hospital workers and nurses and doctors and all the healthcare staff and that sort of thing. And really, you're not seeing that.
Yeah.
Uh, there was like a big study out of some Dutch hospitals where they followed a whole bunch of healthcare workers, and basically none of them are getting COVID in the hospital. Like, there's no patient to patient transmission. There's no like nurse to nurse, doctor to doctor, you know, tech to tech sort of transmission. And the reason is because people are really strict about wearing a mask in the hospital.
And it
You know?
proves that it works. And it's kind of like, per se, my photographer that does my shows, does my press photos, does a bunch of content for me. He worked this whole past weekend for the Super Bowl. He shot the Tory Lanez show, the Gucci Mane show, all of
Oh,
this stuff. No masks around. He wore a mask the whole time. He got tested 3 times this week, negative all 3 times. And it's like, and I think that that's why, like, this whole focus on like these anti-maskers, or however you could say, is so dangerous and detrimental, because the mask does work, and it has the possibility of allowing us to get to a point where we can at least open certain things in states that are completely closed if everybody followed the rules.
yeah, no, absolutely. I mean, like, you see this in Asian countries like Taiwan, for example, which has a super dense population. Like, they're accustomed to wearing a mask when they're sick. I mean, prior to COVID, when was the last time someone, like, where it was okay to call out of work because you were sick? No, I
Oh,
mean, like,
absolutely. You push through it, you go to school, your mom says
yeah.
get better, you feel better, it's all mental.
I mean, on my first day of residency, I legitimately remember our program director saying, "Look, you guys are doctors now. You don't call out.
Yeah.
Like, if you're sick, you're coming to work unless you're dying." You know what I mean?
Hmm.
Like, and we're supposed to be taking care of sick people. You know what I mean?
Yeah.
And that's like the frustration on my part, is that the masks work, and we know that that's true because there's, you know, how many healthcare workers in this country? You know, there's tens of millions of healthcare workers that aren't getting sick in the hospital.
When
You know,
they're around the highest percentage capacity in ICU and all of this stuff around it
yeah,
24/7.
yeah. I mean, like in my group, for example, we have maybe like 30 physicians, and almost everyone that caught it, it was outside of work,
Hmm.
including my girlfriend.
Yeah, and what that's what I'm seeing too from like, and like I totally get the whole mentality, kind of looping it in obviously to my industry of, okay, when people get intoxicated, when people get fucked up, they don't want to wear their masks. It's a higher indicator that somebody is going to decide to take off the mask and not put it back on. But also the things I'm seeing is like family gatherings, house parties, all of these things that are happening that don't have any form of surveillance. So when they walk into a home, they're like, I'm in a safe space. And they don't realize that even though you're in a safe space and the person who owns the home may not have COVID, one of the other 11 people who are attending the party may bring it from somewhere else.
Right. Oh, yeah. And that is such a common, like I see this with older folks because in general, in my experience of taking care of these folks, usually folks that are older have things like, or younger folks that have like asthma or diabetes, those sorts of things are more careful. And it boggles me almost because, all these patients that I've diagnosed with COVID, they're like, well, how could I have gotten it? I've been so careful. Right. And I was like, well, have you seen anyone? And they're like, oh yeah, my granddaughter came over. Oh yeah, I went down to Tennessee. Like, oh yeah, I did this. There's just like this false sense of security in family and friends. Cause like, I'd never hurt my family, right? Like most people never would. And you think they're safe, but you're not.
Absolutely.
And you think you can let your guard down, like literally speaking, by taking off a mask around like the people that you're, close with, because you think that they have no risk of giving it to you. But that's the problem, and that's what makes it so nebulous, is that even when you don't have symptoms, you could potentially still have the disease.
Yeah, and nobody's going to be at someone's house on Sunday watching the football game, eating a pizza on the couch with their mask on. It's not going to
Exactly.
happen.
Yeah, it's not going to happen. And honestly, we're guilty about this in the hospital too. Like, in the break room, that's like a huge source of transmission in the hospital. Is you get, folks that can take a break and then they're sitting and eating, but they're eating around other folks and they're close and they're talking and they don't have their mask on because, I mean, we wear it for 8 to 10 hours a day, 12 hours a day for nurses and those sorts of things. And it hurts your ears and, it fogs up your glasses and all this other annoying stuff. You know what I mean? So like you take it off and you get close to people, and that's where the risk is,
Yeah. Yeah. And I think it's definitely more so probably being contracted in a privacy kind of safe setting opposed to being out in public, because even in Florida, like, yeah, I see families walking around the mall without their mask on. I see people at the Publix without their mask on, but 90, 97, 98% of people are keeping their distance. They're wearing their mask. They've got their gloves on. They got their Clorox wipes. They're being, they're being conscientious about it. But it's like the second, you're completely right. The second that you get around friends or family, you think you're safe, but you don't know where each individual has been. And the way that I'm now seeing being publicized, again, not to make things political, but when Trump was in office, which, don't get me wrong, I'm so fucking happy he's gone. But
Dude,
when Trump was in office and people were coming and saying, guys, the way that this virus is mutating is not natural. The characteristics of it are not like looking at influenza, like looking at these other viruses that we've had in the past, because per se, based on past, viruses, as it continues on and it continues to mutate and more people get it, it weakens. But this is getting stronger and there's new strains. And people also don't know the long-term effects. It's like a lot of kids my age have, contracted COVID. And it's like, even though we don't see maybe the side effects that people my mother's age are seeing, what happens when I am my mother's age? Like, is that going to come back to get me? And it's like a big like guinea pig experiment. But at the same time, like, tell me, what you guys are discussing looking at the mutation of this virus and the different strains that are starting to come out of the original COVID strain.
Yeah, I think that's probably the biggest risk, like right now. And thankfully, when you look at the data, so like with the two first vaccines, Pfizer and Moderna, they both, actually Pfizer just released some data about the variants, and Moderna did a couple weeks ago, where thankfully they're effective against the virus. Like there's a British variant, there's a South American variant, and thankfully like the viruses or the vaccines are still
Good
against those. And the reason is something that's kind of integral to the virus itself is this thing called the spike protein, and that's how we kind of figured out this vaccine so quick anyway. Because when SARS was a thing and MERS was a thing, like way back when, like 10 years ago, that's what those vaccines targeted, and thankfully those pandemics just kind of fizzled out. So the coronaviruses need that spike protein, and a lot of the mutations are in that spike protein. But the danger is if people don't do what they're supposed to, and you still let things go unchecked, and you get this kind of, this spike, and then we lock down really hard, and everything kind of goes down, and then you get another spike when people start to relax. It allows it to make mutations, and we may get unlucky again. You know what I mean?
Yeah.
Where you get a mutation that the vaccine doesn't work against,
Mm-hmm.
and then what do?
Yeah.
You know, you're kind of fucked.
It's like the possibilities are endless right now. And especially looking at, because, obviously Florida is very publicly taking the stance where, our governor has press conferences every day. He's like, they're not shutting us down. They're not going to come down here, and it's just not going to happen. And, as me as a Florida resident, I look around, I'm like, okay, this is the reality I'm living in. I need to adapt. I need to be precautious. I need to make sure my parents are doing their part, like all of that shit. But at the same time, you see New York, Governor Cuomo put out a, statement the other day, February 23rd, they're opening venues at minimum capacity and they're opening stadiums. And it's like, is this a movement that could have potentially been, now that Biden's in office, we're going to push to open X, Y, and Z? Or do you think they're going to open? And what I say all the time is Florida opened 2 times, one in May, we closed again, one in July, we stayed open. And do you think they're going to open? The cases are just going to spike through the roof, and then it's going to be just a shit show until 2022? Or can what do you think based on your experience and predictions?
uh, so if you look at the CDC data, and it's hard to know how many cases there truly are, right? So like we need about 75% of the people in this country to have immunity, either through having been infected or, having a vaccine. And so that's, about 300 million people or so. If you look at the CDC data, they estimate that there's about 100 to 120 million cases. We vaccinated about 35 million. So you're looking at, we're close to halfway there.
Pushing on. And I know that Biden said that they solidified for July 2021, there should be 600 million vaccines here.
Yeah, I think the availability is not going to be like an issue. I think it's more so going to be an issue of, will people get it? There's a lot of just kind of, I think in general, people are kind of apprehensive towards scientists and those sorts of things nowadays. And that's my daily experience in the emergency department. And that's, I think, just kind of what we see,
I feel like it's science versus social media.
Yeah. Like my kind of message and my hope is that, older folks are being careful. Younger folks are, invincible and that sort of thing. Like it's not going to get you. But, I've seen 20-year-olds die, and you don't want to be the dummy that dies from fucking COVID. You know what I mean? Like, I remember when this started, I was driving to work being like, yeah, I would be the one with dumb fucking luck to get COVID and just fucking die. You know what I mean? I'm still, you know what I mean? Like I've sacrificed the past, 10 years of my life to become a physician, and I'm just going to die because I'm going to catch COVID, like taking care of some patient. You know what I mean? Like my hope is that we're kind of past the bulk of it, because from a numbers perspective, we've infected so many people so many, like back when it just got in the country, you could expect that every single person would infect about 6 to 8 people. So like one person who had COVID would turn into 100 in like a week, because if they infect 6 to 8, those 6 to 8 infect 6 to 8. That number has come down significantly, where it's probably about like 1 to 2, maybe 1. The influenza, for reference, is about like a half,
Okay.
So we're kind of getting there. And with vaccinating enough people, I think, like, my personal opinion is, assuming there's no variant that just destroys us all, that by the summer we'll kind of have reached enough level with vaccinations, because we're doing like 1.5 million vaccinations a day. We're still we're still getting, I just looked at the stuff this morning, we're still having 100,000 cases a day that's confirmed. That's not accounting for all the cases where people don't go see a physician and get a test and that sort of thing. So my hope is that by summer we're going to be okay. But the caution is, just like you said, the variant is really the problem. Like what we need to do is we need to get this completely under control, where there's no cases, so we prevent stuff like a variant, because the more we pass it along, the more chance it is for it to mutate into something that's going to really fucking kill us.
Yeah. And so that's just, it's a very obviously like educated answer, and it's just going to be very interesting because I feel this minor shift, and maybe it's just because of where I live, but I try and keep up on the political tabs. My boyfriend and I read a shit ton. Like, we do all this stuff to make sure we're informed in what's happening in all of these other states that have been very locked down, very thresholded. And I feel like there's this shift where people are starting to move towards opening.
Yeah,
And it's scary. It makes me happy. It's scary, and I don't know, what the back end on it is going to be, because as of now, we have Disco Donnie and lifestyle properties, so festivals that are on the books for happening in April, May, June, July.
yeah,
And they've said nothing about it being postponed. They've said nothing. And especially here, we have Sunset Music Festival here. And, after the weekend that we had with the Super Bowl, it's like, why the fuck wouldn't you? You
oh,
know?
I mean, I saw those videos in Tampa. It's fucking nuts. Like, it's just like a sea of people without masks. Like,
See.
like,
And you've got, and it's not like I really think a lot of people like in the EDM community are very like conscientious for the most part, like they are caring, like I've never met really anybody who's been like a total dick like on site. But down here you have a bunch of colleges, you got I hate to like stereotype, you got a bunch of bros, you got a bunch of rich kids, and they're all fuck Biden, and they don't want to fucking put a mask on. And that's the dangerous part.
yeah. I mean, my opinion is if you don't wear a mask, you're just an asshole. You know what I
Yeah.
mean? Like, case in point. I mean, we had it like the problem is just people think nothing bad can happen to them until it happens to them. You know what I mean?
Until it personally affects them.
Yeah. And like just for example, like 2 days ago, I was taking care of this patient who was in the ER for a different reason, but incidentally had a fever. And we just recently started letting visitors back in. So like during the whole thing, like no visitors, which is fucking awful to, if
I
you're
can't imagine.
to die alone. So we literally just started letting visitors back in like 3 days ago. Right. And this guy incidentally has a fever. I was like, man, that's weird. Like, why you got a fever? Is anyone around you sick? And he points to his wife. And I asked his wife, I was like, oh, what's going on? Like, do you have a cough? She's like, yeah. I was like, do you have COVID? And she's like, yeah, I do. I was like, are you fucking kidding?
And she went to and she comes to the hospital.
And I was like, all right. She's like, I didn't want him to be alone. I was like, that's great, but you have fucking COVID.
It's like, why do you think we're here? That's like the epitome of why we're still here. And it's like, that's why it's like stopping from like events like at a wide scale coming back. And the sad part of it is you're completely correct, as in people won't make actual changes to their lifestyle until something personally happens to them or somebody who they love.
Yeah.
And I've said too, like, because I see it all the time on EDM Twitter. I see it X, Y, and Z places. It's kind of like, oh, like you guys are doing the wrong thing. Like it's up to you guys to fix it. Da 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 da. But what I've seen through all of this is you just can't trust the average person to do the right thing. You just can't. And you thinking that like there's gonna be this like enlightening process where everybody just goes, oh yeah, okay, I'm just gonna sit at home and not get my unemployment when I'm being told to work over prioritizing my health, and I'm just gonna make sure that I order my groceries on Amazon with an influctuated price of point whatever percent, and I'm just gonna do the right thing, because they're not. And
Yeah.
and the even scarier part of it is, especially in my industry, is there are DJs playing legal and illegal shows on both sides of it. There's illegal raves in LA, there's legal shows here in Florida that are pretty much put in the same circle as not being morally right now. And the sad part is that when we get through this, and I think in a lot of other industries as well, the people who, I have to word this correctly so somebody doesn't like attack me. I just have this gut feeling that the people who kind of took the back seat and did per se the right thing in an average American's eyes, in, taking into consideration COVID, not taking shows, not progressing X, Y, and Z in whatever job, is going to be behind the curve. And
Yeah.
that's the sad part, is that's the sad reality of it, is that every single headliner, top tier musician that I know doesn't have to take shows right now, because like I won't like I'm a resident, I get paid on a W-2, like there are illegal shows, probably 20 to 30 happening in the state of Florida every Thursday, Friday, Saturday, Sunday night. And you know, I just look at these very top tier artists, and the sad part of it is everybody's like, oh, there's going to be some justification to it. They're not going to get booked anymore. Well, I hate to tell you, the ones who are booking them are the ones that are throwing shows, are the ones that own the festivals. And these guys are still going to be headlining the festivals after COVID is over. And
Yeah.
I don't know if that just made sense. I just like ran in
No,
a big circle to try and like explain that correctly without kind of butchering myself. But I just feel like that's how it is. And I'm seeing it in other industries too, where these people are like taking these opportunities right now because there's not such an oversaturation or a high number of people who are willing to take them. And in turn, I feel like they're going to get rewarded for it on the other side of this instead of punished for it.
oh yeah, I mean, absolutely. That's kind of like the American way, right?
Yeah.
It's like the fuck you, I got mine
Well,
mentality.
it's like we don't live in a socialist country. We live in a country that was built off of capitalism. So it's like, how can you, I guess, expect people to stay home and do X, Y, and Z, where there are other people who are like, you should be grinding, you should be working, you should be going and getting your bag, you should be doing whatever.
Yeah. Oh no, I mean, yeah, it's kind of sad, and kind of to go back to, the point I made about transmission in the hospital, is like you could do all this stuff safely if you could actually trust people to wear a mask. You know what I mean? Like, I mean, I get Snapchats from I'm basically from Florida.
Yeah.
So like I get
Oh, so
Snapchats
you
from,
see it all the time. You know what's going
yeah,
on.
like
And
I
it's
get,
not just like clubs and stuff. Like, I
yeah,
can't imagine what college campuses look like. The frat
yeah.
houses, the X, Y, and Z.
It's just like you can get together, like that's the thing is, we've been let down, you know what I mean, like people have been let down. The ship has sailed on being able to survive at home, not working, and that sort of thing, because like the government just fucking
It's
dropped the
been
ball.
too long. Yep.
Yeah, it's been too long. The thing is you can get together with people if you do it with wearing a mask. like I take care of COVID patients every fucking day. All of my colleagues do, day in, day out, as have like tens of millions of people in this country, right? They wear a mask and it's fine. It's like you can have a show, but you need to enforce a mask and you can't take it off.
What a crazy concept, right?
I know, like that's it. Literally, to have nice things, you just need to do one simple thing.
And
And
people just can't do it.
yeah,
It's like washing your hands. It's
yeah.
like, what the fuck?
And the sad thing is we've seen this before with like seatbelts. I'm not old enough to remember this, but like you look at like when the seatbelt became implemented, there were TV ads like saying like, no, fuck you guys, like I'm not wearing a seatbelt. It's my car. It's like my privacy. It's like, yeah, cool. Like you can get decapitated when you get in a car accident. That's fine. But when you become a projectile for the person in your car and hurt them, then it's an issue. That's the thing about like COVID is like you can do what you want. Like, and that's what I feel like people don't understand is like you're hurting someone else by not wearing a mask. And if you're okay with that, like I don't know what the fuck to do with you. You know what I mean?
Yeah.
Like I literally like I remember I had one patient several months ago. She had a sore throat. She's from Indiana. She had a sore throat. She knew she wasn't feeling well, but she had a vacation planned to Florida. So she goes down to Florida, right?
Oh boy.
She actually gets quite sick. Her oxygen levels are low. She goes to a hospital. She gets diagnosed with COVID. So does her husband. And you know what she does? She's like, I didn't want to be in a hospital in Florida, so I drove all the way back to Indy. That's a 16-hour fucking drive.
And imagine all the places that she stopped for
Yes,
gas.
because she stopped every 2 hours.
I think about gas stations all the time. And because when it was like really like heady, like they were like, okay, you guys got to wear your masks everywhere. All the stores put up the notices, like right when this started, I would always go to gas stations and I'd be like, no one's wearing gloves or wearing a mask while they're like they're pumping their gas. Like they're breathing onto the keypad that they're touching, and then they're grabbing the handle, and then they're filling up their car with gas, and then they're getting in their car and they're leaving. And it's just like those little things are why like I think I get so frustrated, because I feel like it's just like on a political level, they're trying to cover their bases, but it's like this fake covering. It's like this curtain over what actually should be done. And I get that it's hard. Nobody's prepared for this. Nobody knew this was gonna fucking happen. So you can't expect the best from them. But I would just hope if this ever happens again that there is a more prepared team ready to handle it, and that, they actually know how to execute things. But obviously this was a failed effort.
Oh yeah, on like so many different levels, and like like the mask thing initially was saying don't wear a mask or a cloth mask or whatever. I mean, look at the toilet paper pandemic. You know what I mean? Like,
Yeah.
why was that a thing? It's like you're just gonna spend 2 weeks in your house. Like, how often do you poop? You know what I mean?
Yeah. Well,
Like,
welcome to America, I guess.
and that has gone away. So I get like some people are like, oh, well, they said initially don't do this, don't do that. It's like, yeah, they said that because they were worried that was what was going to happen to toilet paper was going to happen to masks, and then people in the hospital weren't going to have them because when this started, I mean, I was wearing the same mask. You know what I mean? Like we were cleaning masks, like
Yeah.
so we could take care of patients because there just wasn't any
Which
supply.
is
The
not
national
good.
stockpile was not a thing.
Yeah.
You know what I mean? Like it's just frustrating. Like on in all sorts of levels, it's failed. Like leadership has failed. Like the thinking people are going to be like doing the right thing has totally failed because we don't care about other people enough to be
And it's
inconvenienced.
like, that's why I wear a mask. You know what I'm saying? And it's like, back to what you were saying. It's just like, I don't wear a mask for me. Like, I know, like, hopefully, cross my fingers. Like, if I were to get it, I'd be fine. I know I would be fine. Most of the people who I know have gotten COVID. We live in Florida. A lot of people here have gotten COVID. And, but at the same time, it's not for me. It's for like, grandma and mom and this and
Yeah,
that. And like somebody else's grandma who I don't even know. And that's why, like, when I go to play legal shows, like I don't I don't mingle with people. I keep my mask on the whole time, and it's just sad that I understand the correlation with like alcohol and substances causing people to not wear their masks, but it's really hard for me in my mind to conceptualize going out and just like not having one on and just not even
yeah,
caring, because on the strip, like in Ybor, where the club that I hold my residency at is, bunch of bars, bunch of other clubs, top 40s, X, Y, and Z. And I remember in like right when the cases started going down before the holidays, we had this like very big dip. And I remember going out with my mask to see a friend from high school, and everybody looked at me like I was fucking crazy because I was wearing my mask. They were like, "What?" Da 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 da. And it's like, you'll get people here too who like laugh at you for wearing a mask. And like, I think that's just fucking insane.
it's stupid. I mean, like you're just being a kind person. That's all you're being. Like they're not hard to breathe in.
They're really not. Right now, it's like honestly, it's like secondhand nature now by the
Yeah,
time we've all done this. And I like personally don't mind if people don't see the expression on my face. Like I kind of like wearing a mask sometimes.
it's changed my world because now my patients can't see my facial expressions. It's great.
Yeah, it's great. And it's just like, EDM kids always wore masks too. You're my
Yeah, it's like a
I
total
wear the
EDM thing.
bandana, wear this, wear that. So it's like we don't have a problem adapting to it, but they also need to understand, like all these kids who live in this EDM Twitter fasted world, that our world is much, 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 much bigger than just, EDM Twitter and
Yeah,
our niche genre. And it's just unfortunate because, again, we've kind of gone back and forth. If all the clubs were to close, if all the shows were to stop, sports would still be happening, gatherings would still be happening. And I just think that we're at a point where we're not going back, and people are going to refuse to go back. I remember when our mayor, they did this like a month ago after the spike from the holidays. They were like, okay, nobody goes on the dance floor anymore. Y'all need to be sitting down. You guys have to be served by a bartender. And everybody was like, you can go and fuck yourself because you told us we could do it, and you're not going to come around 2 months later. And then they're giving out citations for like $100 to bars that are racking up 30 grand at a bar in a night. So it's
yeah,
like a joke. You know what I'm saying? And I just rather be in a place that, I made an analogy to my friend the other day. When I was in high school, we would throw the after parties for prom. And my mom was like the mom, like she was like the mom. But it's like, wouldn't you rather have somebody there making sure you don't drive drunk and you stay the night and you're not being reckless, you're not being irresponsible, than going to some house with no parents and people leaving and getting DUIs and killing someone. I would rather be somewhere where masks are being enforced and you're being either given a citation or you're being kicked out or you're being X, Y, and Z than some underground rave or house party where nobody's fucking wearing a mask and nobody's even thinking about it or enforcing it.
Right. Yeah. Oh no, absolutely. Because the fact of the matter, like you said, is gatherings are going to happen, and that's just there's no stopping that essentially. But like people, like it's not that big of an inconvenience, and especially for like you said, for rave folks, like shit, at all the shows I used to go to,
Every festival, I would
everyone
always
wearing
have a mask.
I was like, I had one, like I had like a scarf one that was like a skull. You know what I mean? Like
Yeah.
everyone's doing that shit. Like no one wants to see your face.
Exactly,
You
exactly.
know?
But yeah, it's a lot. And what I'm hearing too, just to kind of focus on, obviously, you know, COVID affects these people who you wouldn't think would be affected, like athletes, like this and that. Everybody's body is built different. Everybody has different genetics. That's why it could affect somebody who's 20 years old, healthy as can be, and could kill them. And but what I'm hearing now is that the really big problem is that people who do have COVID um are taking up, you know, the beds of people who are really on their deathbed and need to be there.
Oh yeah, that was. I mean, when people were actually scared of hospitals like a year ago, that was a huge thing, and it still is. And that's what a lot of people don't recognize is that one of the big things is like, yeah, there's a lot of COVID deaths. I mean, there's actually a fuck ton of COVID deaths, right? I mean, like almost 500,000 as of right this moment. But there's a ton of those. But what we were seeing is like when I was a resident and this started, you know, I worked at a county hospital where I would see, you know, 3, 4 heroin overdoses a day, right? I would see multiple strokes in a day. We'd see heart attacks, all that sort of stuff. And then that just disappeared. Like all that disappeared. No one, like people weren't coming to the hospital. They were having heart attacks at home. They were overdosing at home. They were having strokes at home and just dying at home. And now, thankfully, people have recognized that they can come to the hospital. But the problem's shifted to there's so many beds taken up by COVID people is that other folks who have other things, which
Yeah.
still exist.
Those still exist.
They're still there. I mean, there have been times where I've waited 36 hours. Like, I think my record was like 36, 38 hours on a patient who needed to go to surgery, who couldn't because there was nowhere to send her. Like, and this was at like,
And this is the kind of stuff that people like aren't talking about. And it's just like, that's like fucking insane. And for some reason, it's like people have forgotten that these other like things, like everything that existed before COVID still exists. Like
yeah,
there were still people in the hospital before COVID.
right.
I got sick maybe a month ago and you know, got tested, whatever, not COVID, and I had the cold. And it was like, yeah, guys, like the flu still exists, cold still exists. You know, all of this stuff is still there and still like negatively affecting people on a much greater level.
Yeah.
And that brings me to like my next question. As I remember, I tweeted, and of course I'm like a fucking target because I live in Florida, but it's fine. I was just like, you know, the one thing that people are lacking to talk about, and I don't know if it's just because you can't talk about somebody being overweight nowadays with somebody not being, you know, saying, oh, like you're fat shaming, you're whatever, da da da. The one thing that I see no government officials talking about, no one but like stupid people like Joe Rogan on their podcast, is how important it is to like maintain a healthy lifestyle and like take care of yourself. Because I feel like a lot of these cases could be prolonged and could not have happened if people would have taken care of themselves beforehand. At
Oh,
least
yeah.
a percentage.
Yeah. I mean, shit. I may have my numbers like slightly off, but I think something like 60, 70% of adults in the United States right now are overweight. I think the number is like a third of children are overweight, which is just a tragedy.
Crazy.
You know what I mean? Like, here's the thing, and this will just be, like, I talk about this with my patients all the time, is if you looked at me, right, I'm just going to wave around, like you'd say I'm skinny, right? Medicine is based off of someone my size. There's like a concept in medicine of the average man, and he's a 70-kilogram man. That's exactly how much I weigh. I'm an average guy from when medicine was like written 60 years ago. And now if you look at me, you're like, no, you're really skinny, dude. And that's because our perception
is enlarged
of weight. Yeah, just like portions have gotten so much bigger. Like everyone is so much bigger now. Like nobody exercises. Like, I ask, like, I don't even bring it up with patients because they just get offended. You know what I mean? Like, but it's a real thing. Like with chronic back pain, for example, it's like, yeah, maybe your back hurts because you weigh 100 extra pounds than you should. You know
You
what I
would
mean?
think
Like,
that would be like common sense.
you would think so, but yeah, we've become so lazy. You know what I mean? Like, and food, like fast food is so easy, and like, fuck it. Like, I used to work at McDonald's. Like, it tastes good. You know what I mean? Like, I like shitty fast food, but you know what I don't do is go eat shitty fast food all the time. You know what I
Hmm.
mean? And I get like people have a lot of jobs and they have to like work, and it's hard to like it's hard to do. Like, it's hard to maintain like a healthy like eating
It's
habit and
hard and expensive. It's
yeah,
it's three times the price of you going to McDonald's and getting something for your whole
yeah,
family.
and it's way less convenient. You know what I mean? Like, you have to cook and prepare it, and vegetables go bad quickly and all that stuff, and it's awful. You know what I mean? And but yeah, there's like a huge, there's a huge thing. I just saw some paper the other day saying that like overweight is like healthy, and it's like it's not. You know
It's
what I mean?
not. I don't
And
care like what you say, like the evolution of like our body, no matter like in any circumstance, it is not healthy to be what I think is a little bit heavier than the average American's weight right now. And
no,
and I know when I put it into perception that I'm not fucking crazy when I see people who come from overseas and they come here and they're like, you guys eat this much for dinner? Like, this is your portion sizes? Because
yeah,
it's not like this around the world. And I'm
yeah,
not talking about third world countries. I'm talking about other first world countries come here and they're like, oh, like it's the American supersize me. Like it's this. And like, of course, I know I'm gonna get like comments on this or whatever. It doesn't really matter because I want to have the conversation because I mean, like my friends in the circle I have, like it is a priority to us because we want to live a long ass life. We want to be able to be active. We want to have nutrient dense diets because it's important not only for your mind, but for your like physical body.
yeah,
And it's just like obviously there is a huge percentage of people who have COVID where it has been genetic, it has been something else that has existed within them and it has caused them, it caused a negative reaction to them. But I do think it's bad to not acknowledge the fact that some of these could have been prolonged if America put more focus on how important diet and exercise is.
yeah.
And that it's not fat shaming. It's like if you're overweight and I tell you like, yo, like I've done this to my friends before, like, hey, let's go to the gym. Hey, let's like meal prep. Let's do this. It's because I fucking care about you. It's not because I'm fat shaming you. It's because I don't want you to fucking die.
Yeah,
Like,
like, I mean, yeah, that's like, it's like a tragedy to me. You know what I mean? Because like, not to get crazy deep, but like you just have your body, right? Like, regardless of like money and like power and like all this other stuff. Like, at the end of the day, like, one thing that you have is like your body. That's yours. Like, you can take care of it however you choose to or not. You know what I mean? And it's just like it just super upsets me that like, you know, so many people just don't seem to care. You know what I
yeah,
mean? Like, you just don't care that you're unhealthy. And I see people who are 40 years old look like they're 60, 70 years old because they're so overweight because they smoke 2 packs a day. You know what I mean? Like, I can always tell a smoker. Like, you know what I
mm-hmm.
mean? Like, I know. And like, and you look at them, and then you look at like some patients who come in that are 90 years old, right? You know what I've never seen? Almost never, like, is a fat 90-year-old. You know what I mean? You know why? Because they've taken care of
Yeah.
their body to get to that place. Like, it sucks, doing a whole bunch of stuff that's just like negligent to your temple. You know what I mean?
It's
Like,
like you only get one, guys. Like
yeah,
you
you
can
only get
get
one.
plastic surgery up and down the wall, but like it's not your body. And it's like that's what I see nowadays, especially with like girls my age and stuff. Like, do what you want. You want to build your temple, you want to get lip injections, boob implants, whatever, go for it. But it's like all of that shit has to be maintained. And like crazy thought is like just take care of what was given to you and you wouldn't have to do X, Y, and Z.
Yeah.
You
Oh,
know?
no, totally. That, I mean, when you look at, the biggest issues in like American healthcare, aside from like all the policy of it, you know, most of it comes down to just people are just, they're too heavy, they don't exercise, they smoke. You know what I mean? Like, and in general, they're just like, we call it non-adherence now because it's not PC to say they're not compliant. It's like, but we become so like, politically correct. Like you're right. Like we can't talk to people about this stuff. Like, I'm an emergency physician, so I'm like not their primary care doctor. You know what I mean? But like it's even awkward for me to bring up someone's weight. You know what I mean? And I've kind of developed ways to kind of just like bring it up a little bit. You know what I mean?
Yeah.
Like, without saying it. Like when I see a young person with, like say like someone like in their 20s who has chest pain or whatever, I'm like, look, you're here in the emergency department because you obviously care about your health. You know what I mean? So maybe like reflect on what you can do better. That's kind of like how I've started to do it.
Yeah.
They know, like
They
they
all know, like they
know,
touchy
right?
subject because it's very hard to blame other factors when it has to do with your own body. And I think a lot of people, especially in our generation, have this like really big problem with realizing that like the problem is you. Like the problem is like you. Like it's not their fault. It's not their fault. Like it's you and it's your decisions. Like you get up every morning and you think for yourself because you're an adult.
Oh yeah, I mean, like and I don't want people to think like I'm privileged. Like I grew up super duper poor. When I was in college, I was working 60, 70 hours a week. Like I've been there. You know what I mean? Like you have to make decisions that are congruent with like a decent lifestyle. When I was working 80, 90 hours a week during residency, and you can't possibly bring enough food during the day, and there's just like a shitty cafeteria, right? Like you could get the shitty cafeteria tacos and just be awful, or you can get the even shittier cafeteria like white fish and it tastes terrible, but it's at least like.
But I feel like it's like everything in moderation. Like,
Yeah.
fuck yeah, like I enjoy going to have a huge bowl of pasta somewhere and some nice steak with some toppings and all that shit. And like, yeah, when I was in college, I was at a college that had school Monday through Saturday. I worked at Morton Steakhouse and I worked at a country club. And then I started DJing. So like I totally get like the grind, and I would go through cycles of meal prepping and then I'd be like, fuck this, dude.
Yeah.
And I'd just like get Chick-fil-A, I'd get fast food, I'd do this. Like, but it's the fact that I just don't think people have like the mind consciousness of it to say, okay, this is the position I'm in right now. I got to do this to make sure I get something in my body, da 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 da. And but the overall picture is like, hey, when I'm able to eat like this, I'm gonna eat like this and be conscious of it and go to the gym and get my steps in and all that other shit.
Oh yeah, absolutely.
Yeah.
In general, we just don't have, again, like kind of like masks, right? Like the personal responsibility has just kind of gone out the window. You know what I mean? And that's what you see a lot of, is that we just don't have it anymore. And the trend is, I mean, shit, like another 20, 30 years, if people keep going this way, like everyone's going to be like that. You know what I
Yeah.
mean?
Well, then that's going to be the evolution of the human and this and like and it's just sad that like I feel like the minority speaks because like the whole nutrition and fitness industry is a huge industry. It's there, but it's only there if you look for it, if it's in your like conscious line of sight. And I feel like the like number one problem of where it stems from is when you get into this like top 5% of corporations and businesses in the United States and you look at who owns these companies and who's working with these politicians and all of this stuff. And that's why you still see whatever tobacco company doing huge numbers in 2022 or 2021 when we know that shit kills you and
Oh,
nobody's saying anything, you
oh
know?
yeah. No, I mean, you know, absolutely. There's no way around that one. It's the same reason why, like, like alcohol is still somehow legal. Like, how many people does that kill? How many?
Literally just with Al Ross on my podcast yesterday. And I was like, how the fuck is it legal for me to destroy my stomach acid, potentially like just not remember anything, but I can't smoke weed and I can't like do this. And like I get it, like I get it. It's there's all like controversial stuff, but I just like don't understand how something that's so bad for your body is legal, but then something that has like this like scientific backing of how it can help people and X, Y, and Z is like illegal, and you can go to jail for a very long time for it.
Oh yeah, it's all politics. You know what I mean? Like, unfortunately, like when you look at like kind of how weed came to be illegal and other substances and that sort of thing, like it's all political, unfortunately. Just like why, big tobacco is still a thing, why, like, you can still have alcohol ads in this
Yep.
country. You know what I mean? Like it's just a normal thing, right? Normal thing to go get drunk. Like,
Yeah. And
and
that kind of segues me into like when we come back. I personally know people who travel to Florida to party, to do whatever, because we're one of the only states open. If you're on the East Coast, you're coming down to Florida, you're going to Georgia. And I feel like I'm seeing these people get so messed up because their tolerance is not what it used to be a year ago. And
yeah.
and going back into, hopefully in quarter 3, so like end of summer, fall, we'll be having events, hopefully nationwide at capacity, masks. How, how do you think all of these people our age should properly like reintroduce these things to their body? Because I've been hearing one of two things. Either I have an individual who went into lockdown and they're drinking every day, they're doing other stuff, or I have someone who went into lockdown and they're like, I'm not going out, I'm not going to fucking drink, I'm not going to party, I'm not going to do this. And to have somebody who has done it for X amount of years and then stops doing it for a year and then comes back to it, that's very dangerous in my mind.
Oh no, absolutely. And like, I'm gonna say this by, obviously as a physician, I can't advocate doing drugs, right? But
Obviously.
it's kind of like the condom argument, right? I mean, people, like, young kids are going to have sex, right? And that's just the fact of the matter, right? And you can make it safer by teaching them about condoms, right? And people at raves are going to do drugs, right? And that is just a fact.
Yeah.
And what I see a big lack of, because, I go to like every show in Indy, you know what I mean? And I like, people always, well, what do you do? And then like, whenever they're like, oh, you're a doctor, like, what do you think about, this substance, that substance, blah, 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 blah. Right? Like, what I find that there's a big lack of education in is, one, ensuring that the substance that you have is in fact the substance that you think it is. Is
And
probably,
that's why I love things like Dance Safe and other things that you see at
yeah,
festivals.
yeah,
Everybody should be doing that. I remember when the fentanyl shit happened, like right before lockdown last year. I mean, like, rest in peace, Mac Miller, like all of that shit. And it goes all the way up. I'm not just talking about like an
yeah.
average human, it goes all the way up the chain to artists, to celebrities. And
Oh,
it's like, from being someone who's backstage in green rooms, I see how shit is passed around. I see how substances are exchanged. You have fans who come in that have stuff and like all of this shit, and you don't know where they got it from. Like,
yeah. Like, this is my opinion on it. You can, obviously, if you're doing substances, you can afford to spend a couple bucks, right? Because like you're buying stuff.
yeah.
Like, a test kit is like $50, right? And it will last you a lifetime. Okay, it takes like a drop to test a substance, and from there you can tell if it's something that is safe to ingest, quote unquote, right? Like, I
Mhm.
mean, if you're trying to, eat a bunch of Molly, you'd probably want to know that it's that and not meth, which is
You would
commonly,
think.
you would think, right? And the thing is it's so easy to test that and see, but no one does. Like, I ask people at shows all the time, because inevitably they start talking about this stuff with me, because like, oh,
Oh, absolutely.
I was like, oh, do you test your stuff? No. Like, what do you mean no? You know what I mean? Like,
There's no excuse. There's literally no excuse. And it's
yeah,
so easy. And then, especially like you have that for a lifetime, it's just like, and it's
so,
crazy how people like prioritize things to me,
yeah,
because I don't think you spending X amount of money, I don't think the $50 is worth you dying or taking something that's going to permanently fuck your brain up for a really, really long time.
yeah. And like, fentanyl test strips are cheap. You can get a box of them for nothing at all. You know what I mean? And they're great. And like cocaine, for example, is very commonly adulterated with fentanyl because it kind of makes the high from cocaine a little bit better. Like MDMA is very commonly adulterated with meth. Like ketamine could be adulterated with all sorts of wacky shit. Like PCP is very similar to ketamine, those sorts of things. And like, to go along with like the testing thing is like, I guess I get it. Like, you buy a substance, right? And then maybe it's not what you thought. And now, well, now what the fuck do I do? You know what I mean? Well, you should probably make your dealer test it with you before you buy it.
You would
You know what I
think.
mean? And if they're not willing to sell it to you, well, then I don't
Well,
know. I'm not.
that's your answer right there. If they don't want to have
Yeah,
it tested, that's your answer.
yeah,
And it's kind of like, again, what you said before, like, no, I know tons of sober ravers. I haven't touched anything in so long. And it's like a way that I've just chosen to live my life because I like being on stage. I never want to jeopardize my friends, my family. I don't want to jeopardize my life here. I don't advocate doing substances. But to say that people don't use substances and rave is ignorant. And
yeah.
it's turning your head to the side
Yeah,
and just choosing to ignore it.
right.
And, and I think it's just good to bring this awareness up because I'm just seeing way too many people overdose and this and that, all while we're really not even raving. So it's like, I feel like when the gates open again, people are just going to be getting stuff left and right. Let's go, let's party, da 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 da. And to have that awareness of, hey, you're going to have really bad guys at the top who are going to take advantage of the situation, try and make as much money as possible, and they're not going to give a fuck who dies.
Yeah, no, they don't. I mean, and I've seen more overdoses from opiates and those sorts of things than you could possibly imagine. You know what I mean? Like to kind of go along with the testing thing, like the other part of it is that you should like not just like say eyeball drugs. You know what I mean? And this is information that you can find like kind of easily online to, at least, dose yourself correctly. You know what I mean? But like,
Mm-hmm.
these things in general, they have bad side effects. Like for example, like MDMA, and they have a lot of like stuff that's just flat out wrong. Like for example, with MDMA, everyone knows, oh, you're dancing a lot, you're sweating a lot, you should drink a whole bunch of water, right? Like just drink water, drink water, drink water. I remember when Excision came to town, and I missed that show because I was working.
No. That was that the Thunderdome tour or whatever, like the huge one that he was doing before we closed?
No, it was 2 years ago, 3 years.
Okay. Okay,
I
so
saw
like
him.
one of just his massive ones anyway,
Yeah,
like
just,
in a
yeah.
huge venue, yeah.
And I remember I took care of this girl who had a seizure, like, and she was at the show and she had a seizure and that sort of thing. And I was like, oh, well, what'd you take? And she's like, oh, I took some Molly, whatever, blah, blah, blah. I was like, well, how much water have you drank? And she's like, oh, well, I drank like, I know I got to drink a ton of water, right? So I drank like half a gallon of water. And I won't get into the science, but maybe I will. But like Molly actually does something that makes you like retain a whole bunch of water, which can really fuck up your electrolytes if you're drinking a whole bunch of water. Like you get water poisoning from
When
drinking.
I was 18, everyone said you take Molly, you drink water.
No,
Those two things are a phrase together.
yeah, no, you take Molly, you eat something salty and drink Gatorade, because what happens is if you take enough of it, you're driving your sodium so low from drinking all the water, which doesn't have anything in it, that you're going to have a seizure. And that's like a classic move is a young girl.
Well, I see that in every
Gatorade.
corner at every festival. I mean,
Yeah,
you go to Ultra and half the girls are on the ground. Like
yeah.
I mean, it's just the reality of it. But yeah, it's just so crazy to me because it's like obviously before I am doing what I'm doing now, I was a raver. I went to Ultra. I went to all these festivals, and like the thing you would always say is have water, is drink water.
Yeah, and it should really be like, my thing is always like drink Gatorade because it's going to be like electrolyte imbalance.
Or like BCAs, bring some BCAs, bring some other stuff. It's like
Yeah, and there's just like a lot of misconceptions about stuff. Like, for example, another one, like I use ketamine to sedate patients all the time in the emergency department, like for procedural sedation, because it's a great medicine to like, say if you got to put a bone back in or something like that, or put a shoulder back in, it's a great medicine. Like what people don't know is it can cause a thing called laryngospasm, where basically your vocal cords shut really tight and then you can't breathe. And this is rare.
that is terrifying.
Yeah, and this is rare because I mean I do this all the time. I've never seen it. The reported like amount is like less than 1%, but that can still happen. And what do you see like at these festivals? People sitting around in their little circles, and then someone is just completely fucked up ketamine because they're completely unmobile. Like
They can't move. They're like,
yeah,
goodbye. Yeah.
I'm like, what if that happened to one of your buddies?
And like nobody knew
And,
how
and
to.
you didn't even know that was like a thing. You know what I mean? Like you didn't even know that was like a possibility of happening with the substance that you're taking. You know what I mean? Like people are gonna do them, but you should like try to like know as much as you can about it. Like I remember with cocaine, for example, I could do this for every single substance. Like with cocaine, it's very commonly adulterated with this thing called levamisole, which is a anti-parasitic medication they use in sheep. So like 70% of cocaine in the United States or something like that is adulterated with this. And in rare cases, it can cause a thing called levamisole-induced vasculitis, which basically causes your skin to just die. And I saw this patient once. She's like 30 years old. She's addicted to cocaine. And if you Google this, like it's not for
That's the biggest problem,
yeah,
side note, that I see on the back end of the industry. People don't roll back here. They're not Molly munchers. They're
yeah,
not XY. They're not taking ketamine, most of them. They're all doing coke.
yeah. That's
That's
a
stay
total
awake,
hard
party,
thing.
talk, not be fucked up, be able to drink alcohol. That is what I see the
Yeah.
most.
And I've seen, I've seen people my age have heart attacks from doing it. You know, and like it's hard on your heart, especially when you do as much as that. And like in this patient, like her, like she was disfigured from it because she was literally like allergic in a sense to a contaminant of cocaine. Like her nose had fallen off, her ears were just completely gone, her skin was just all necrotic and just like dead leather, and she like was probably very pretty, and I remember that she told me the most heartbreaking thing, right? Was she's like, I used to be so pretty, right? She's like, I used to be so pretty, but I'm so addicted to cocaine, I can't stop. You know what I mean? Like, and I know
And it's like heartbreaking. That's
yeah,
heartbreaking. It's whenever you see a friend or like a patient with an addiction and it just like breaks your heart because you're like, fuck, like how did they get here? Like how did
yeah,
nobody around them care enough to be like slap you in the face? Like what's going on? Like we got to fix it.
yeah, and that kind of brings like another like just kind of giant point is that in this country we just don't care enough. Like we label people that use substances, we label addicts as bad people, right?
And they're
Which is
not.
and they're not, which makes no sense to me because like who do you know that doesn't drink alcohol? It's like rare, right? Like, no offense,
Our
like
parents, our grandparents, like
yeah,
I all the way up my family, we're
yeah,
all drinking.
like I don't care if you do or don't, but like most people are like, oh, why don't you drink? You know what I mean? Like it's weird. Like so, in one hand, it's just like, oh, everyone should be drinking, right? And that's just a thing. And if you're not, you're weird. But like, oh, if you do, like if you smoke weed, you're a bad person. You know what I
You're
mean? Like, oh,
bad. Yeah.
yeah, you're like bad. And then what we do is we send people like to jail, right? Like we send. Now, I'm not advocating that you should like go shoot up a bunch of heroin and get in a car, which I see all the time, unfortunately. But like, if you're in your house and you overdose and your buddy calls 911 and the first people to respond are police and the police see that you have a syringe next to you, they're going to arrest you. And then what the fuck's going to happen?
Well, then that goes into our privatized prison system, federal prison system. And I would love to know the percentage of people who are in there for hard drugs compared to actual crime and actual violence. And
it's awful.
yeah, and it's like, and those people don't get me wrong, those people don't deserve to get thrown in like a mental ward and X, Y, and Z. Those people deserve to be with people like you to help them get better and to help them figure out, because taking somebody off drugs who's been addicted to drugs for X amount of years cold turkey is going to potentially kill them. So
Yeah.
so that's not the way to do it and lock you in a cell and call you crazy. It's just not the way that it should be. And it's just, I feel like we talked about so many different things today, but they're all somehow like intertwined.
Yeah.
You know? And because it goes back to the whole thing where like people just kind of turn their head to alcohol and they turn their head to like, oh, like an overdose is just something that happens in America. Oh, people who are addicted to hard drugs, it just happens. You always have that bad egg, da da da. But then it's like COVID comes along and it's like, everybody stop. Everybody stop. We have these people dying, da 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 da. But it's like, do you know how many people every year die of overdoses and every year are just like constantly like addicted and growing addictions to these drugs that are just kind of like on the streets and nothing's really getting done about it, and there's fentanyl and there's X, Y, and Z, but it's just an American thing. It's just a part of America.
Right. Yeah. And a lot of it is because it's just so taboo to do it. And then people can't find out how to like do stuff safely. Like arguably there's a safe way, like there's a safe amount of drinking alcohol. I mean, there's numerous studies that show like a beer a day helps you live longer. Like that's just a thing. One beer like that improves all-cause mortality. So does coffee, by the way, like a bunch of coffee. Like
this is like, I got you. This is like, I've got that part taken care of.
You know what I mean?
Yeah.
Like, and that's like the problem is like, especially with substances and that sort of thing, is you're such a bad person if you do them. We don't invest any money in like, one, educating people to do it safely. Two, like if you have an issue, to get rehab. Like rehab is so fucking expensive.
It's
It's
so
awful.
expensive.
And
It's
and
like
I'm
90 to like hundreds of thousands of
yeah,
dollars.
it's unaffordable. You know what I mean? And I love what Oregon just did with decriminalizing basically everything, which is
Mhm.
great. And a lot of people are like, oh, like, well, now everyone's going to do all these drugs. I'm like,
No,
no.
they're not. If I was an Oregon citizen and I was like, okay, cool, I wouldn't be like, all right, let's go to
Yeah,
the corner, let's go to
yeah.
town.
Like,
No,
all right,
that's not
I'm
how
just
things
gonna have some
work.
heroin. You know what I mean? Like,
Yeah.
no, people aren't going to do that. But instead, you know what they do? If you get caught with a small amount of substance, they give you the option to potentially go to a rehab place. And we know that the more you intervene, right? Like the more times someone who smokes cigarettes get asked, like, hey, have you thought about quitting? The more likely they are to quit. You know what I mean? The more times like someone who does substances has met someone like, you know, like a physician or another provider that can say, hey, have you thought about your substance use? Like the more likely they are going to be cognizant about it. You know what I mean? Like Portugal has done a great job with this, with their opiate issue, is they decriminalized opiates, and instead all that money goes into rehab. So if you overdose,
It's
like
amazing.
you like there's easy ways to get rehab for opiate addiction, which we should have, and we don't. Instead,
Yeah.
what we do is when people can't afford oxycodone or hydrocodone or whatever pill that they got addicted to, you know, from physicians of 20 years ago prescribing it, like, and we've gotten a lot better about that. You know what I mean? But you have all these people like they can't afford their pills. Like a fucking pill of oxycodone is like $20. You know what I mean? Like, and that's a low dose for some people. You know, like of course you're gonna go turn to heroin eventually.
Well, that gets us into the conversation of just America's healthcare in general.
Oh yeah,
You know, I went to a specialty doctor the other day. That's just a general specialty doctor annual checkup, and I have healthcare insurance. No, it's not the best, but you know, I'm paying for my healthcare insurance and then I'm paying $225 on top of it for me to spend maybe 7-8 minutes with the doctor to make sure I'm okay. Like,
yeah.
what the fuck, dude? I can't imagine if I had a problem. Imagine if I had a problem.
Oh
Imagine if I left that $225 appointment and they said, "Hey, like there's something wrong. You need to start taking this stuff." And then that 225 turns into 600, 700, 800, 1000.
oh yeah. No, I was actually just talking with one of my nursing colleagues about this. You know, the other day, like that's a very complicated like topic that can kind of be distilled down to people 50 years ago were kind of greedy. So like to make a short thing out of it, like a lot of our reimbursement is tied to Medicare. And when Medicare became a thing, what people realized is, oh, if we just charge more and more for like an appendectomy, taking out your appendix, like, well, then the private insurers that existed before will have to pay more. You know what I mean? Or this, that. So like they just drove prices up, and then they made it like this big negotiation thing, right? So now like the way that when you have your appendix taken out, depending on what kind of insurance you have, well, your insurance company has said, I'm going to charge infinite dollars for this appendectomy, but then the hospital is going to bargain with you and be like, nah, I don't think that. I'll pay you like this much, and we'll base it off of this Medicare rate, which is, I don't know if that exactly makes sense, but Medicare basically says, if you have Medicare and you need your appendix taken out, it's $5,000. And then the insurance company, like Blue Cross Blue Shield, will say, nah, I'm going to pay this much money. You know what I mean? But I'm going to charge $20,000, and then they're going to negotiate, and hopefully they'll negotiate it down to get somewhere close to Medicare. So it's like, that's why no one can find out how much things cost. And it's so convoluted, like almost a third of the people who work in healthcare right now are billers, which
Yeah.
is silly. You know what I mean? Yeah, like we can get down like a huge rabbit hole on like healthcare, but
That's
we see it
so
in the emergency
crazy.
department. Like, we see it in the emergency department all the time because we see people who don't have health insurance, who can't get into their doctor, who it's too expensive. And you know what they do? They come to the emergency department for a problem that should never be there, right? And then they just don't like they just don't pay,
Well, then
or
it's just a bill of debt.
yeah, exactly. Or they just get like, and then they're just in these crushing medical, in these medical bills for something that could have been prevented if we had a good system in place to take care of people. You know what I mean?
Ugh, it's such
Like,
a mess.
yeah, like my take on it is health insurance in this country is not like, it shouldn't be called insurance. Like I have insurance for my car if I get in an accident. I don't have insurance for going to get an oil change.
Yeah.
You know what I mean? Like that's on me. Like I should be able to go to a doctor and pay like to get a checkup and pay a reasonable amount, and then I should have insurance for when there's an issue. You know what I mean? And the ACA kind of did like stuff to fix that, but not enough.
Yeah.
It's just awful. And we see, we're kind of the front lines of healthcare because we're the entry to the hospitals. You know what I mean? Like,
Absolutely.
yeah, and we just see how just poorly everything is. And like with COVID, without COVID, you know what I mean? Like,
Yeah, it was fucked before COVID.
yeah,
And
it
then
was fucked.
COVID was just like that little cherry on top that just kind of made the whole Sunday melt. And
Yeah.
like it's just and I talk about it all the time too, and like hopefully it doesn't like make you feel uncomfortable, but I just like it's just such like a fucked vision of how everybody in like our society, especially our generation, looks at like these influencers, DJs and artists and this and this and that, and like we really don't do shit. Like we're like expressing ourselves and like this is really cool and like we're keeping up this lifestyle and stuff, but it's like you guys are the ones that are like there. Like you guys are the ones like at the front lines, basically the reason why people are still living. And I just hope that, I don't know, I feel like things are just starting to get like reset to like a certain standpoint. And maybe it's just our society like imploding on each other. I just hope that there's like somewhat of a switch of focus to these certain professions in America that were taken for granted before this period of time. And
Yeah.
because they're just like, oh, like you'll be there, like you'll always be there. But it's like, what happens when we make it through this and all these people are like, I don't want to fucking do this shit anymore? You know what happens? Because if I'm not a DJ, it goes, okay, you're not a DJ, like cool, da da da. But if you're not a nurse, like if we lose a certain percentage of our nurses, a certain percentage of our doctors, of our emergency physicians, like yourself, what is like the future of this country going to look like?
Oh yeah, and you're actually seeing that. I mean, like the amount of like COVID has really taken a toll, like on just general population's kind of mental health, and then also like physicians' mental health. Like you know, the amount of people that doctors have seen die. I mean, like I've seen a lot of people die, right? Just in which is unfortunate to begin with, and then you get COVID along where you're seeing like several people die a day, which is very
Yeah.
unusual. You're having providers that are getting PTSD from just like it's like almost like a combat veteran. You know what I mean? Like you've just seen so many awful things where they're getting PTSD and getting all this bad like depression, anxiety, and like all this other stuff from seeing all this awful stuff. And yeah, you're right. Like a lot of them, many of them just may not be there anymore because they just can't physically and mentally do it.
Yeah.
Like imagine those poor providers in Italy, like when it was,
Oh my God.
like I've thankfully never been in a situation where like if a patient needed a life-saving procedure, like where the resources weren't available. But I came close one day.
Yeah.
Like we had run out of ventilators. Like there's another machine that's similar to a ventilator, like a BiPAP, and we had run out of it. And thankfully we found one like in the corner of the hospital. But a patient needed this thing and we didn't have it. And like prior to that, that was never a thing,
Mm-hmm.
And like I can fix many, many problems. You know what I mean? But like if you don't have the resources to do it,
It's
like
not going to happen.
yeah, and and that like it feels like that's on you. You know what I mean? Like because the system has like so impressively failed that like the doctors in LA County like just even recently like I mean it's awful what they're having to do. They're literally having to pick and choose who's going to go on a ventilator. And that was never a thing. You know what I
No.
mean? Like it was never a thing. It's if you need it, it's fucking got it. You know what I mean? Like this is American healthcare. You know what I mean? Like
Meanwhile, people are like renting out Airbnbs in LA and throwing these like massive fucking parties that are making like TMZ.
yeah, like and that's the crazy thing is like, you know, like American healthcare is very much we'll do everything always.
Yeah.
Which I don't always agree with, but you know, when it's a reasonable decision to do everything and you can't do it, that takes a toll on the people who are supposed to be doing it for you. You
Yeah.
know?
Absolutely. It's a lot, dude. I'm so happy you were able to like come on and just talk and just like give some information because I talk to DJs and I talk to other people and all this stuff, but I feel like this is something that are in our industry that I enjoy talking about, COVID obviously because it's a current event that's going on that has affected us all greatly.
Yeah.
But going into, alcohol and substance use is just something that tends to be ignored over and over again. And, when somebody dies, kind of like what you said with like the Italy thing, it's like it was such a big thing around the world. And then a week went by and then nobody talked about it anymore. And I feel
Yeah.
like those are like the issues that we have where we keep repeating ourselves and not learning from our mistakes. And then it happens again in a very short span of time.
Yeah.
And everybody goes, oh, why is this happening? Oh, rest in peace. Oh, da 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 da. Like, this was so hard. Da, da. But it's like, why the fuck did it happen? Because you fucking overdosed, dude, because you had a mental illness and the people who were close to you and your team decided to turn a blind eye and look the other way, and then you passed away and you died.
Yeah.
And and it's just, it sucks. It's crazy.
Yeah. And apropos of you saying like DJ's talking about this, I saw on Alice in Wonderland's Instagram her saying how there's so much misinformation about COVID.
Mm-hmm.
Like, and there is. And I'll demystify that in a short sentence. It's wear a fucking mask.
It's that simple. Like, it's literally that simple. Like, we could literally like, and what I thought was so interesting too was that when you started to like watch these spikes, we obviously, especially in my industry, we're predominantly in liberal states, big cities, not rural areas.
Yeah.
But you would see places like North Dakota and Montana have the biggest spikes. And you're like, what the fuck's going on over there? You have a ratio of the people, but then you find out that they're having town hall meetings telling people that wearing a mask is taking away your civil liberties and your freedoms and this and that. And that's why you have the most amount of cases with the least amount of people in one given area.
Yeah. I mean, or they just don't believe it exists. Like like one of the hospitals I work at is in a very rural, like part of Indiana. And I've lost count of how many patients I've diagnosed with COVID that have basically said, no, fuck you, it's not COVID. You're just saying that because someone's paying you and you're getting extra money. It's like, I'm paid by the hour, dude. Like,
yeah, it's like, I don't have to fucking tell you shit. Like,
you know what I mean? Like, look, I'm just telling you the cards you were dealt. You know what I mean? Like, I have no stake in this game, dude. Like, I give zero fucks, but like, you got COVID. And like,
I just know so many places that are in rural areas that like the whole mask thing never even happened to begin with.
Yeah, which is awful. You know what I mean? Like, going back to like a earlier point, it's like people are seeing science evolve in real time, and they like when we used to treat heart attacks, we didn't give people stents. We gave them like systemic, like blood clot busting medication through their veins, and then we realized, oh, we could do it better with a stent. The way strokes are working now is we give them blood clot busting medications, but now we're starting to treat it kind of similar to heart attacks. And in 10 years, you're going to be like, why the fuck did we ever do that? Yeah. And in most of medicine, it's such a gradual change in knowledge, right? It's so slow, you don't even perceive that it's like a thing. And in COVID, everything has happened so fast. Like we didn't talk about like therapies for it, you know what I mean? But like the whole hydroxychloroquine thing, the whole ivermectin thing that you may be hearing about now.
Yep.
Like, the monoclonal antibody things, like you're seeing like a small set of data that says something may be effective. And then when you actually do the studies, you're like, no, it's not, but people have already latched onto that and can't realize that like as scientists, when we get better information, we change course. Like as an emergency medicine doctor, like when I see, like I have an initial impression about a patient, and then if I see something that doesn't fit it, I don't just keep trying to hammer a fucking square peg into a round hole. I got to change. You know what I mean?
Yeah.
Like, and that's what people are seeing. And we just like, for whatever reason, so resistant to that. You know what I mean? Like the only thing that works for COVID is time, steroids, and if you're bad enough to need a ventilator, putting them on a ventilator and hoping that you don't die. Like that's it. Like just support, we call it supportive care, like supportive care and steroids. That's all that works. All this other stuff doesn't.
It's all like an experiment. Yeah.
Like, but it's same with like, oh, people who think like vaccines cause autism. You know what I mean? Like,
the shit like, that I've heard and like read, and like you kind of intertwine social media with all of this shit now, and you look at like the Facebook news and this and that and all of this stuff, and it's just like there's so much information, and it doesn't help that it's none of the government officials' fault, it's none of the doctors' fault, but no one's dealt with this before. So of course, as they discover new information, they're going to let the public know. Yeah. But it doesn't help for all these people who don't trust it to begin with, for actual like officials to be changing the guidelines and changing what they're saying almost on a day-to-day basis for a while.
Right. Yeah, absolutely. And that, and I get it, like when I put on my scientist hat, like, yeah, that's just how science works. But
it
like,
is.
for folks that don't have that background for no fault of their own, they don't like, well, what the fuck do I believe?
Yeah.
You know what I mean? Like, you don't know what to believe because it's changing. And in medicine, sometimes we don't know. Like there are other conditions I treat where I don't actually know if what we do is the best thing, but that's the best information we have. And that's just the reality of it. You know what I
Yeah.
mean? Like, and we don't have an answer for everything. Like medicine is not like some fields of math or like a chess game where it's been solved. You know what I mean? Like, it's dynamic, it changes, we get new information, we have to adapt to it. And COVID was really compressed. Like, we did all, like, think of how crazy it is that we took the mortality rate from what it was down to what it is now, that we went from no
Oh,
vaccine
it's
to vaccine.
amazing. It's
Like,
amazing.
you know what I mean? That we went, like, you saw what could happen when you have unlimited resources and like the entire human collective, like, dedicated to fixing a problem, and we fucking fixed it. You
We're
know what I mean?
so
Like,
powerful, but we're so stupid at the same time, because I look
yes.
at it like, not to compare the two because they're obviously not comparable, but I look at the whole fucking Wall Street bet shit, and it's like, all it took was the average American to agree on one thing, and look what y'all did to the top hedge fund people. Like, look what you did in one day. Like, that's how, and just people just, I mean, obviously everyone is entitled to their own opinion. That's what makes an individual, but it's amazing to see what can happen when people actually come together and think, and you get very intelligent people like in your field saying, all right, we got to do this, like, we got to
Yeah.
make it happen. and
Yeah.
and you get shit done. And like, what has been done by medical care professionals and scientists and government officials to come together to get to where we are at, even though it's still a mess, is pretty fucking amazing. It's pretty
Yeah.
amazing,
I mean, yeah. I mean, literally, when you look at how effective the Pfizer and Moderna vaccines are, those are probably the most effective vaccines ever. Like, ever.
Well,
There's
that's what they were saying, the 90 percentile. And you look at like the influenza vaccine, and that's like 55% or 52%.
and there's data from Israel, actually, which has a massive effort to vaccinate their whole population. I was looking at the numbers earlier, yesterday or this morning, something like that. They followed 540,000 people who got vaccinated, right? So from the start of it, only 4 of them had severe COVID, and none of them died. So you took 550,000 people and essentially took the mortality, the morbidity of COVID completely away with the vaccine. Shit works.
Yeah.
It's amazing. It works like a miracle. You know what I mean? Like, people need to get vaccinated and wear a mask.
Yeah.
And that,
It's very simple. It comes down to almost a 2-step
yeah,
process.
and turn off social media,
Yeah.
because like Alice in Wonderland's post, like, you know, your research on the toilet on Facebook, you know, reading something does not negate like a scientist's research. You know
Yeah.
what I mean? Like when you're looking into something, you have to evaluate whether or not you in fact understand what that is to begin with. You know what I mean? 'Cause I can make anything sound good. Like, don't fucking trust me. You know what I mean? Like, do your research. But doing your research may involve, you know, cracking open a textbook and actually like learning something. You know what I mean?
Yeah,
Like,
and like, pay attention to your sources. Like, I just don't understand how like school and like high school was probably such a terrible time for most of us. And like, I just remember having to cite my sources every fucking time I wrote a goddamn paper. And now, if you see a headline on Facebook News, oh, that shit must be true. Like,
yeah, exactly.
no.
And then not even that, like, take it a step further, but go to the source, right? Like if you see it where they cite it, go to it and then evaluate whether or not it's good information.
Mm-hmm.
You know, and that's a big push in medicine that we used to not do. We call it evidence-based medicine, but like, that used to not be a thing. And now, like, we've like really swung the pendulum to like really being like kind of critical, and like the new generation of physicians like myself are very like adept at looking at a study and being like, is this good information? You know what I
Yeah.
mean? That's how we got into the opiate issue in the first place, because the data was really bad, and doctors looked at it and they couldn't actually evaluate that it was like bad. And like, that's how the autism thing came, because people read this awful paper that actually got the guy, that he lost his medical license over the paper. Like, but
Wow.
we hold on to stuff. You know what I
Yeah.
mean? Like we do stuff in medicine, and it's crazy. Like, this is still true. Like, we do stuff in medicine because that's how it had been done, and we may not have any evidence for it to begin with. And in some cases that works. Like, I don't need evidence that a parachute saves a life, right? Like, I'm not going to study that, because that'd be a bad idea to push someone out without a parachute and see what the fuck happens to them. Like, in
Yeah.
some cases we do stuff without evidence because we know it works and it would be harmful to study it. But in new stuff, you know, like in COVID and like other things, like, we need to critically look at the data and the information. And that's a hard thing to grasp, you know.
Yeah.
Like, it's hard for physicians, and like, think of how much training we have, you know what I
Yeah.
mean? And it's hard,
Absolutely.
you know. So like, imagine if you don't have, you know, and through no fault of your own, like, I'm not shaming people for not having, like, you know, science background and that sort of thing, but you really gotta wonder, like, do you really understand what you're reading, you know? Because chances are you may not.
And
And then
that's
that
where it
can be
becomes
hard.
dangerous.
Yeah, absolutely. And that, you know, and yeah,
Oh,
it
lots of stuff. I don't know. Thank you like so much for coming on and like just downloading this whole bout of information. I'm so excited for people to listen to this, and thank you so much for continuing to like work every day, making sure we're safe, getting kids back to raves, all of that fun stuff. I can't wait to like finally meet you when this is all over.
oh
But
yeah, for sure.
yeah, I am very excited for people to hear this. Thank you so much, Joshua, for coming on. I feel like we just like went all the way across the board, and I'm really excited, and I hope people will be able to listen to this, and it'll, you know, having a healthcare professional, not a Twitter EDM crazy person, spouting off actual, statistics X, Y, and Z. I greatly appreciate your time and all of that fun
Yeah,
stuff.
no, thanks for having me. Really, like, I mean, that's the goal. We want to get back to normal life, and I need snails to come to Indianapolis again.
Yes, yes.
And I need to get down to Tampa so I can see you play. You know,
I
and invite.
know. I know. I need to come to Indiana. I just need to come
Yeah.
there. We just need to go there. But no, thank you very much. I'm going to stop recording really quick, okay?
Yeah, yeah.